Next, multiple projections on one image plane. Okay? A scanning projection pattern. The beam and part should be centered within each pattern. Okay, so what do we mean by pattern? A section of the plate has to be separated from another. Okay? And collimation should be parallel and equidistant from the edges of the imaging plane. So when this is an image, your plane is like this, right? And you're gonna be putting two images on it. You have to have collimation here and collimation here. This collimation here has to be equidistant here and here. Otherwise the system might not recognize it. Okay? Also, this cannot be too close. If they are too close, there's a space here. It will put it in one image. Okay? And so you need to separate it very well. What is recommended to do with imaging plates is not just to collimate because it's so sensitive that parts of the plate, if you expose here, and this part will also get exposed, will have lots of scatter radiation because of the sensitivity of the plate. So what is recommended is to cover this plate with lead. Cover this portion with lead, expose here, cover with lead. Okay, then when this is done, cover this with lead, expose this side. Or vice versa. You know what I'm talking about. Okay?
Okay.
All right, so it always has to be covered. Yes, Garrett?
So basically, the picture here shows two. You're making two images on one plate.
Mm-hmm.
Oh, okay.
Are there any facilities doing this?
Not as far as I know. None of our facilities do that. I think they found out, like what I was saying before, it's just easier to just do one per plate, then you can, because the bills are created automatically and the bills are charged per plate that you do. Yeah.
And it just seems that this is so prone to making errors and having to do more repeats.
You know what? I have used it like that when they first came out with PCR. It works fine. It works really well. Good. Yeah. Okay. I don't think you're saving anything. I mean, with saving, and I'm talking money saving. With film, you were saving film, but here, you know, you can reuse and reuse the plate, the same plate.
If you're working with a bucket, I mean, how would you?
Oh no,
I
with
mean,
the
you
bucket.
can't do it in
No, with the bucket.
Okay.
No, with the bucket. However, you can do it with fluoro. If you're doing a spot films in fluoro, yeah, you can split the plates. Yeah, but with bucket, no, you cannot. All right, so automatic mode used when collimation is parallel and equidistant, and the central ray and part are properly centered. Okay, they're going to be properly centered. If they are not properly centered, your computer will give you, will not read the image properly. Okay, and it'll give you a funky image. So it has to be. We're going to do an experiment. I'm waiting for some equipment that I sent to be calibrated. Once we get it back, we're going to start doing the labs. So one of the labs we're going to do, we don't have to wait for the equipment. What we're going to do is to show you how important the central ray is when using CR plates. It's extremely important. It's just as important as your technical factor. As you begin to move away from the center of the imaging plate. In either way, I mean, a couple centimeters away, your image begins to look very different. Okay, and the computer reads it as if you have done it with a different technical factors. That's sensitive, and so. But here, going back to the plate, so here even more, they have to be properly centered, both images or whatever many images there are, and everything has to be equidistant. If it's not, all kinds of problems. Semi-automatic mode can be used when collimation is not parallel or equidistant, so you have a little bit more freedom. The fixed mode requires use of proper technical factors. That's the key there. Take proper technical factors, because computer, like I said before, is not going to help you. Even if you have 2 or 3 images, doesn't matter. Okay? If you have have multiple images with proper technical factors. That's key there. Okay, a histogram. I wanted to get to this point because this is important. What is a histogram?
Graphic.
It's a graphic, right? It's a graphic representation of something, right? Okay. For example, when you're having an EKG done, that's just only a graph of what the electrical signals in your heart, or you have an encephalogram, or an electron encephalogram. That all it's doing is measuring electrical waves in your brain. Okay, that's a representation. That could be some type of histogram. Okay, it's just a graph representing something. So a histogram in digital system is a graphic representation. It's a graph. Okay, when say graphic, is not. Don't think of a picture yet. This is a graph. Okay, this is a graph representation of pixels and signals, intensities present in an image. So what it's doing is you're doing pixels and signals, and so you're going to see a graphic representation of a chest X-ray, a graphic representation of a hand X-ray, a graphic representation of whatever X-ray you're doing. Are you with me? Okay.
Excuse me.
Huh?
This is what means the signal intensity.
Where are we? Where are you looking at?
It's a histogram.
Okay. And signal is what areas of the graph are going to be higher and which ones are lower. For example, when you're doing a chest X-ray, okay, chest X-ray, patient here, where do you have on your image, not on me, on your image, where do you see the highest signals? What area?
In the lung.
In the lungs. Because why? Because photons are just going through. Okay, so those are the highest signals. On your graph, on your graphic representation, areas that represent the lung are going to be up. Okay, areas that represent the mediastinum are going to be low. Okay, and then another lung. So this is a possible. This is only an example. This is a possible representation. Okay, a histogram of what a lung should look like. Maybe it's not going to look so deep, but maybe something like that. This is going. Okay, make sense?
Yeah.
All right. Lookup table data contains a standard, contrast, speed, and latitude for a given example. This is why, let's go back, I don't know, maybe 6, 7 slides when I told you to pick the correct exam. Remember I told you that?
Mm-hmm.
Okay, you have to pick the correct exam. So you can have the standard contrast, the standard speed, and the standard speed. What is the speed referring to?
First to how fast it.
Let's go back to your previous exam, previous section. Speed has to do with what? The screens, right?
Screens, yes.
Okay.
How
And what
fast
does
it.
RS stand for? Some of you failed out of the test. What is RS?
Relative
Relative speed. Okay. All right. And so the system, with digital systems, we don't use the speed, but okay, since technologies are used to that, you can mimic. You can tell the computer, I want you to reconstruct this image as if, okay, I emphasize, as if we were using film, 200 speed or 400 speed or 100 speed. Make sense? So the computer can do that for you, okay? Because you're not going to develop an image, say for example a hand X-ray, you're not going to develop it like if you develop an abdomen, okay? The abdomen, you want to develop it more like if it was a 400 speed, and the hand X-ray more like 200 speed, okay? So the system can do that for you, okay? And latitude for a given, latitude refers to what? Shades of gray. How many shades of gray are we going to apply? And so this is what the computer system does, okay? The computer system, not the computer system, but the manufacturer, listen carefully here, the manufacturer, along with the hospital, they decide what a good chest x-ray looks like, okay? And as you have seen, especially once you start moving from different hospital to hospital, you will see that the quality of any x-ray, say a chest x-ray, is not the same everywhere you go. Radiologists look at it, they get used to looking at certain exams in a certain way. And so it is the manufacturer and the hospital, they decide what an ideal image looks like. They make exposures, they present those images to the radiologist, and for every image, there is a histogram, okay? And so the computer has think of it as a master histogram. Okay, your computer has what your hospital, what your radiologist considers to be a good chest x-ray. So they have a representation of it, they have a histogram, and then what they do is when you make an exposure, they also created a histogram for you, okay? And if you are in the automatic mode, what they will do, they will match the two. And they will make your image as much as possible fit this graph. Okay? And so you're saying, well, that doesn't, the computer's analyzing it, goes, it doesn't really look the same. How about if I do this? And how about if I do this? Because I still have that information is contained here. Okay? That kind of looks the same. Okay? That's where you have your image. Okay? Make sense?
Mm-hmm.
All right, that's what it's done. And so when I say contains, look up data. That's when you're looking at data. We're looking at a histogram. Now, the histogram is constructed from where? How do you, when you're making a graph, how do you construct it? What do you need?
The raw data.
Raw data. And where do you get that from? Remember, this, when we have this graphic representation, what we have points, we have values, right? Yes or no?
Yes.
Yes.
You have these values, right? And so what you need in each one of these values, if this is your X and Y's, okay, this one represents, 1 and 1. So this value is 1 and 1, right?
Mhm.
Yes?
Mhm.
And so this value, that's the lookup data, the lookup table, okay? The lookup table of data are a bunch of numbers. It's a whole bunch of numbers that are used to reconstruct this. You following me?
Mm-hmm.
Huh?
I think so.
Yeah, okay, good. So that's the lookup data. And it contains, so what is contained here is contained in a set of numbers. I only put one set of numbers here, but you have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 50 numbers. Okay, 50 set of numbers is what you use to construct this data, right? So all the information that we have, and the same thing here, we have a whole bunch of numbers. Yes?
Yes.
Okay, and the computer will use those numbers, those standard numbers, to, when you present your exam, your case, okay, it will make it to look more like the numbers, the set of numbers. The computer doesn't need an stinking graph. Let's put it that way. What do we need the graph for? So humans can understand it, so we can understand it. So when you look at, okay, but the computer doesn't need it. The computer needs a whole bunch of numbers, right? And it will mix the numbers and it will come up with an image that is represented in your lookup data. Make sense? Yes? Christina Cosenza.
So, okay, to compare the latitude and contrast, latitude's like the number of shades of gray, and the
Yes.
contrast is the difference between those shades of gray.
And the what, I'm sorry?
Latitude's the number of shades of gray,
Uh-huh.
and the contrast is that the difference between the shades of gray?
Yes.
Difference between, okay.
Yes, yes,
They seem similar.
yes. High contrast will be very abrupt differences, very black and white. Okay. All right.
Thank you.
Uh-huh. Garrett Tam, you had a question.
Yeah, so I just want to make sure that the LUD would just look up data, and if I understood it correct here. So it's basically a group of number sets that is used to reconstruct the data. Is that right?
Yes, and there is like a master plan of numbers. And your new numbers, the numbers that you have obtained with your image, you're gonna match them up with the master plan
Okay.
to reconstruct an image that resembles very much what the radiologist and everybody thought it was good.
Oh, okay. So,
That's why you notice that, and this is one of the beauties about digital systems, that in your facility, all chest x-rays look the same. And I'm not talking about the anatomy, obviously, that's gonna be different. I'm talking about the way they look, the gray and the blackness, they pretty much look the same. Even if you have an obese patient, you have a thin patient, the lung color, the grayness of the lungs are pretty much the same. That's why, because every image is processed in the same way. Okay. When we use film, it was difficult for the radiologist because one technologist, even though you were using the same technical factors, but if something changed, even from images with the same patient, even images with the same patient, they look different. Okay, now, if you have the same patient, you're doing a chest x-ray every day, you go to the ICU and every day you x-ray the patient for 5 days, you look at it after 5 days of x-rays, you look at the x-rays, they pretty much all look the same. Okay. If the technologies have been consistent, if you start fooling around and putting angles and more distance, the purpose of you, the technologists, of putting, when you do a portable x-ray, is to put your technical factors. You put 110 kVp, 8 mass, 62 inches, upright. That information is not just a vague information. That information is used by the technologist who's going to do the next chest x-ray, so they can use the same technical factors. So they can use consistent. So the images can be consistent. That makes sense? Okay.
Is that why, let's say, you do your technical factors and then the exposure index would seem like it's so off compared to like the AP or lateral view? It's because of that, the machine of the histogram, and they're like trying to mimic a past.
No, what happened there is because the technologists use something that is off the algorithm, the numbers that are the accepted values. For example, and this is just a number, a chest x-ray can have a value of, say, and I'm talking Fuji system, so those of you who are not used with the Fuji system, just ignore it. Say a number S200 to S700. Okay, those are the values that you want, and sometimes you're off
The range.
that range of 700, say you are at 1,000.
Yeah.
Okay, that's because the technical factors were not good, and the computer cannot do anything. Okay? I mean, it makes sense? In that case, the computer is still trying. It will give you an image, but once you look at the image is not going to look right. Okay, but that's not what I was talking about. What I was talking about before was, I don't even remember that. What I was talking about before was your computer comparing the information that it has with what it's going to, with this. Now, the graph, once again, it's for us to see, to give us a sense of where those numbers are. Because if they didn't show us this graph, they're going to show you, they're going to show you a screen, and I seen it. It's in a screen full of numbers. Full of numbers. 1, 2, 3, 1, 2, 0, 1, 2, 0, 1, 0, 1. A whole bunch of them. A whole bunch of them. I mean, the whole screen is full with those numbers. You're going, what is that? It doesn't make sense to us. And so we can make sense of that. That's what we have this graph. With this, it makes more sense. Are we on? All right. Okay, appropriate part and projection selected by the reader prior to the processing. Okay, you also have to tell the lookup data. Okay, what is it? Is it an AP? Is it a PA? Because otherwise your image is going to be reconstructed like a PA or an AP. Okay. A few more things. True patient image information is determined. Okay, and this will be automatically rescaled. okay? And this is what I was showing you before. In the algorithms that are used for processing, an algorithm is a mathematical formula, okay? That's all there is. It's just a fancy name mathematicians use, but it's saying this is a formula that we are going to use to reconstruct these images, okay? Make sense? All right, so that's all there is. All right, a few more things, okay? Histogram adjustment, image processing in proper range of exposure, okay? Yields consistent grayscale regardless of technical factors, okay? So what this is saying is this. Even if your technical factors are off, this is our master plan, right? This is what we said. This is our master plan. Even if our technical factors are not perfect, they don't have to be right in the middle here. Even if our technical factors in our data, set of data, say is off here, is more here, is more to the side, say between here and here, your algorithm will still fix it. Okay, if it is to this extreme, you can fix it. The problem is when you are out, when you are here, or when you're here. If it's not contained within this system, then the computer will still try to reconstruct it, but your image is going to be lousy. And you're going back to what she had asked me, your numbers are going to be off. Okay? If you are beyond this point, what it's saying is that your image was grossly overexposed. Grossly overexposed, and your image will represent that. Your image will look dark. Okay? In some cases, I've seen it. Something is weird. And I need to ask why. But I've seen it when grossly overexposed parts, the image turns white. Why? I don't know. I don't know. I need to ask. But what I do know is that when your exposure is too low, you have lots of quantum model. Quantum model becomes very evident. So you have to be within this range here. If you're here, between here and here, the computer will work with you. The computer will help you fix it. Are we good? Okay. All right. So that's what it's saying here. Yields considered here. If you are within that range, outside of appropriate range, system cannot compensate. The system cannot make it look good. And here's the thing, let's go back to the analogy of the sweater. If you give them good quality wool, okay, and enough wool, you will make a nice sweater, okay? But if the wool, first you start with very little wool, you're not gonna have enough for a sweater. And instead of having, gonna have holes in there, right? Okay, because you don't have enough raw data. If you have too much raw data, way too much, your sweater is going to be so compacted that no air is going to be able to go in and out. Okay, and it's just too much information. So the same thing here. If you have not enough, you'll get a sweater, but it's not going to be a quality sweater. If you have too much, the same issue. Okay, you're going to have a sweater, but it's not going to be of the quality that you decided that you were going to use. In the case of X-ray, chest X-ray, for example, if you don't have enough photons, enough raw data, you're going to have holes in your sweater. If you have way too much, then your X-ray will have just so much information that it's not going to be, you're not going to be able to see. Just by giving it more raw data, more photons, it doesn't mean that you can have a better quality image. Now, what we know with computerized systems, what we know is that, and please don't use this as an excuse to overexpose patients because it's not ethically correct. Remember what we're looking in the other class, Alera, right? That's the principle that we base the work that we do. But it has been found that if you overexpose a patient by 400%, the system can still fix your image. I mean, that's,
What's the latitude for underexposure?
for underexposure, you can only go down about 40%. So it's not much. But 40, I mean, the number goes from 40 to 60. It depends who you read, but it's not much. But going over it, and this is the one that I'm more concerned. Okay, going over you 400%. I mean, this person doesn't really have a clue. Doesn't have a clue of radiation what radiation protection is. It doesn't have a clue of technical factors. I mean, if something is someone, I mean, once in a while, like I can see someone made an accident, you know, a boo-boo, and you know, something was going on, and they call you, it's that, you know, somewhere, and then you come back and try to complete your exit. Yeah, you can make a mistake. I understand that. A mistake is a mistake. Okay, once in a while, one in the full moon is fine, but if it's repeated, someone is doing this, that person shouldn't be doing this.
Are those numbers the same for CR and DR in terms of how much you can overcompensate?
In terms of what? Yeah, pretty much.
Or CR and DR? you can
Yeah,
expose
pretty
more
much.
average?
Yeah, yeah. I think DR, I think is a little, is more sensitive in the sense that, something like this will not look good in CR.
Okay, so they
So
can,
it'll be less, it'll be
Less.
more like 300%. But with CR, it is about 400%, which is crazy. Okay, all right, a couple of slides here. Okay, image reprocessing, the raw data, okay? The raw data is stored by the CR system. So once you're done with your x-ray, all right, say you did a baby chest x-ray, okay? All right, once it's done, you process the image, you send the image to PACS or Stentor, whatever you send it to, okay? And that raw data is stored in the system, okay? That raw data, that raw wood or raw whatever, raw cotton or plastic, whatever you have, is going to be stored there for a little while. Now, raw data those are huge files. That's why you don't send them to PACS, because if you start sending raw data to PACS, in a year, PACS will be, you know, it reached the limits. Probably 6 months, maybe less. This is huge information. That's why it's kept in your reader, in your computer reader. It's kept there for a few days, and then it just, once you run out of space, is deleted automatically. But you can keep it there for about 3 days, 4 days, depending on how busy your hospital is. And that's important. You're saying, well, it's important because in case you need to go back and reconstruct the image with a different algorithm, you can go back. For example, this is what I had mentioned to you before. All right, we do this chest X-ray, but this line here, and I can see it. Let's just think that is not well seen. I can go back and reconstruct this raw data. I can go back and reconstruct it like an abdomen. Okay, that is going to show me more soft tissue. It'll be easier for me to see this line. Or I can go back and reconstruct it in different modes, in different algorithms. Maybe I want to see a little more contrast. Well, I'm going to develop it as if it was a finger X-ray. Make sense? Got it?
Yeah, how we can come back?
Huh?
How?
You go back to the patient. You call the patient again, the raw data, say for, I don't know, Annie Wee. All right, we have her chest X-ray. So we go back and click on Annie's information, comes back, and then you tell the computer, I want you to reconstruct it like a finger. Reconstruct it like an apple. Huh?
That's something the radiologist can do?
We can do it too.
We can do it too.
They cannot, because from where they are, their information is in PACS. They cannot reconstruct images. They can change the shades, they can change the colors, whatever, but they cannot reprocess the image. Because what you're doing here, if I said, let's reprocess it as an abdomen, you're reconstructing everything as an abdomen X-ray. So instead of being our algorithm like this, it could be something that looks more like this. Because this is an abdomen, this is a chest. Make sense? So you can go back and reconstruct, make a new, it's a total new image. Okay? It's a total new image that you're doing. But you're not exposing the patient again.
Total new images, but the same projection.
It's the same projection, but the way it has been reconstructed, the characteristics of shades of gray,
Oh,
resolution are going to be different.
Isn't VR system the same, right? VR,
Huh?
I mean the portable that I practice in the VA, the portable machine, they have this kind of two different, we exposure one time and then click another one, it come out like more lighter and more clear. See the two.
Probably, I need to see it,
Oh,
probably. Huh?
We call it the mass. They created, especially when they want to see the lines, the big lines, they create another image with mass.
Yeah, and then you're
So it's
reconstructing the image, yeah.
Yeah, and then the doctor can see more detail.
Do you send both pictures?
Sometimes.
Yeah, okay, then you are,
Yeah.
then you are, yeah. That makes sense, guys? Everybody? Questions? Side note?
Is this a good example of the enlarged images?
Yeah. See this part here? Yeah, it's an emergency design. Yeah. On humans, you're not gonna see, on humans. On adults, you're not gonna see that. This is a baby humanoid. The test, half of you guys, I graded, but the other half I haven't, so I feel that it's not fair for me to give it to you, so I'll have it Monday. But pay attention, probably, I need to do a presentation at 1 o'clock, so probably, this afternoon, I'll post your grades. Because all I have to do is finish up with you.
Or Monday.